Europe has emerged as the new COVID-19 hotspot. Ahead of the Christmas holidays, countries like Austria have already entered a lockdown, while many others are looking at some form of restrictions. The surge in cases have prompted the United States now to issue a travel advisory for U.S. citizens, asking them to not travel to Germany and Denmark. The State Department issued a level 4 advisory indicating very high level of COVID-19 in the two countries. Let's take a look at the situation in some of the most affected parts, starting with Germany. Residents there have been warned that they would be either vaccinated, cured or dead from COVID-19 by the end of the year. This statement was made by Germany's health minister as he urged more citizens to get inoculated. The slow vaccination rate is one of the reasons why cases are on the rise in Germany. Only 68% of the population is fully vaccinated. Intensive care beds are fast filling up in the worst hit regions, prompting the local authorities to order new lockdowns, including closing the Christmas markets. The Chancellor has warned that Germany's current COVID-19 restrictions, which include banning the unvaccinated from certain public places, were not enough. Meanwhile, in the Netherlands, the Dutch Prime Minister condemned 3 nights of unrest, which rocked the country as pure violence, and called the anti-lockdown protesters, I'm quoting here, complete idiots. He also promised to prosecute those responsible for the violence. The situation in the country seemed calmer on Monday, though, after 3 days of relentless protests. At least 130 people have been arrested, 4 injured by gunshots, and several police officers injured since the violence broke out on Friday. The country went back to partial lockdown on the 13th of November after a record spike in cases, and the government has warned of further restrictions unless the cases decrease. So far, bars, cafes, restaurants and supermarkets are allowed to remain open only till 8 p.m. The crowds have been banned from sporting events. The country is also contemplating bringing in a law which bans unvaccinated people from entering public spaces like cafes and amusement parks. On to Austria now, where the streets are quiet as the country imposed the most drastic restrictions taken by any country in Western Europe so far. Its 8.9 million people are only allowed to leave home for work, to shop for essentials or to exercise. Austria also plans to legalize a vaccine mandate from February.
Ich bin eigentlich schon ziemlich im Limit, muss ich ehrlich sagen. Also psychisch und körperlich, vor allem wegen Corona halt.
Wir müssen wahrscheinlich alle damit leben, ob jetzt geimpft oder nicht geimpft. Corona bleibt und ich glaube, bis in die nächsten Jahre müssen wir damit leben.
Meanwhile, in France, the Prime Minister tested positive for COVID-19 on Monday. His office said that he would be isolating for 10 days while continuing to work. Jean Castex had been in Brussels on Monday, where he met his Belgian counterpart, Alexander De Croo. The Belgian Prime Minister and 4 of his ministers also went into quarantine as a precaution. France is also seeing a surge in cases, with the latest 7-day increase in daily cases 3 times that of the cases recorded over the previous 3 weeks. The government has said that the 5th wave is starting at lightning speed. The UK, meanwhile, reported an additional 44,917 fresh COVID-19 cases, 45 new deaths. The scientists have warned that caution is crucial at this time and advised people to delay planning Christmas as long as possible. Europe's return to becoming the epicenter of the pandemic has been blamed on slow vaccination drives of certain countries. The highly contagious Delta variant and colder weather is leading to the people being indoors once again. For more on these developments, joining us are our correspondents Ryan Thompson from Frankfurt and also Benji Iyer from London. Coming to you first, Ryan, the Chancellor has said that the current restrictions are not sufficient. Tell us more about the restrictions that are being considered at this point.
Well, as of last Thursday, the German parliament met to outline some types of new restrictions. They looked at the new government, which is expected to come into power potentially next week at the earliest, which has really advised that they want to end the emergency pandemic powers, but at the same time, they know there is a crisis at hand, and they want to introduce rules that really incentivize people to get a COVID-19 jab. From Thursday, we've seen new rules come into play, which really, if you don't have the jab yet, you will find it much, much harder to partake in public life. I'm talking about the simplest things, taking a bus or a train. If you are unvaccinated, you are required to have a negative test result no older than 24 hours to prove that you are not carrying the virus. In other places where the incidence rate is particularly high, notably Saxony or Bavaria, they are introducing a rule that is so-called 2G+, which basically means it's only open to people who are vaccinated, it's only open to people who are recovered, but on top of that, on top of having that burden of proof, you also need to have a negative test to really make sure you are not carrying this virus. The government is concerned that this situation could get out of hand. They are looking at numbers like they've never seen before. In the words of the Chancellor Angela Merkel, speaking to party members on Monday, she said, "This is the worst phase for Germany in the history of this pandemic."
Right. Benji, the UK government has received criticism for not doing enough at the right time during the earlier waves. This time, with the number of cases on the rise, over 44,000 fresh cases reported, merely advising people to delay Christmas plans might not be enough, is what the experts are saying. Is the government considering a return to some restrictions?
Well, when you look at what the situation is in Europe and what's been unfolding, as Ryan explained there, you might think that the UK is about to follow suit. But there is evidence to suggest that the UK is better placed to deal with these current rises. For example, the fact that Europe opened later than the rest of the UK and lifted those restrictions later means that we're seeing this extra rise in cases and this spike on the continent, whereas in the UK that happened slightly earlier during those warmer summer months, and it happened amongst a population that was well immunised against the virus either through natural immunity or through vaccinations, and therefore the UK and the UK government feel that therefore they can almost ride the wave of this virus in the coming months because the worst of it is behind them. It's a very different situation in Britain compared to, as I say, the rest of the continent. With that said, what we've learned from the pandemic is it's important not to be complacent. It is expected that cases are going to rise at certain times during the winter months, which the UK is entering now. Already some governments as part of the UK putting in their own restrictions. Scotland pondering some, Northern Ireland already strengthening its work from home conditions. And if history teaches us anything, it's that England often looks at what the other home nations are doing, Scotland, Wales and Northern Ireland, looks at what the rest of Europe is doing, and a couple of weeks later decides to implement its own restrictions. So we're definitely not at a point where the British government feels it has to impose any nationwide lockdowns again. But it's important that we don't rule anything out here and that we keep a very close eye on what the virus is doing in the UK.
All right, Ryan, what are the factors contributing to the low vaccination rate? To what extent is vaccine hesitancy still a hurdle?
Well, there's a huge disparity in vaccine take-up across the European continent. If you look at some countries like Spain, France, Italy, but largely due to people's desire to have the vaccine, but also due to government measures that were introduced over the summer that, again, disincentivize people who chose not to get the jab. They saw a huge uptake in the vaccine. In France, nearly 89% of all people over the age of 18 have gotten their coronavirus vaccine. If you look at a lot of the Germanic-speaking countries, however, including Austria, parts of Switzerland, and here in Germany, that number is significantly lower by nearly 20 percentage points. In Austria, it's at a stubborn 64% and not upticking any faster. That is why the government has chosen to, from February 1st, introduce a mandate which makes a coronavirus jab compulsory. Here in Germany, it's a bit higher, 68%, but though you can see long queues of people waiting to go and get their jab, people are warning that it is just a false sense because many of these people are seeing what's going on with the impending pandemic situation and going to get their booster shots now that they're eligible. The people who have chosen not to get it up to this point do remain largely stubborn.
Benji, what's the verdict on the vaccination drive in the UK so far?
Well, it's actually been a big success, not just the initial vaccination, where there was a huge uptake amongst all groups of the population, but also this new booster campaign. Essentially, it's not enough in the government size to call yourself fully vaccinated after only 2 doses. It's now encouraged that you get that extra 3rd dose, which provides people with even more protection and immunity from this virus. That booster campaign has been rolled out to the most vulnerable people, to frontline healthcare workers, and now if you're over the age of 40, you are also able to book yourself in, and as I mentioned, the uptake for that is quite high. So the government hopes that by encouraging enough people to take that extra booster vaccine, again, people will be properly protected and immunised over these crucial winter months. What's different compared to Europe or the rest of the mainland Europe is that in the UK there's no sort of government mandate requirement to get the vaccine, and there's not one really if you want to go about your daily life by going to restaurant, bars, cinema, theatres, whatever. Some places do require a negative test, for example, but it's very rare in the UK to be in a place where you have to show your vaccine certificate, and yet in spite of that we do find in Britain that the vaccination rates are still particularly high, and so if that rate continues, the British government will be optimistic that it can see through the next couple of months and not have to put in serious restrictions like we're seeing in places like Germany, Austria, the Netherlands and Belgium.
WION now available in your country. Download the app now. Get all the news on the move.